what does fascia do? It does a lot of really cool things. So the first one is it helps create support in the body, right? And it protects the body. And so when there's, particularly, like I said, an injury, it's going to say, let me help stop bleeding. Let me send the necessary blood cells there for healing. And when it creates that structural support, it creates that like solidification of the area so that it doesn't just kind of flop around, all right? The other one is huge, is our movements. So fascia is going to help with helping you be flexible, right? So it helps that glide. And so when you're pregnant, when you're in labor, that motion is lotion. I have said this for years. We now have an app for nurses to be able to help you with your motion in labor. And so when you're thinking about labor, that sort of staying still and not moving and not stretching and releasing and even just moving your body is going to impact potentially your whole body and create restriction in the body. That's like the opposite of what we want. The other thing I want you to think about is like, say like you fall asleep on a plane. And like, even now I'm like, my fascia is restricted because I can't even like put my head to my ear. But say you fall asleep on the plane and then what happens? When you wake up, you're like, I'm so creaky and like, ouch, ouch, right? And we're trying to lift my head up and then you start to stretch. Fascia crystallizes within 15 minutes of immobility. So you have your head like that for more than 15 minutes, it's gonna crystallize to help create support. But then when you start moving, you can actually release your own fascia. So what's so fascinating about it is a lot of other places, if you have a restriction or you have a pain or you have a problem, you need to go to like physical therapy for that. And you're like taking all this time to heal those tissues, but you can actually self-release. And then you can help set the body up for that movement and that openness, expansiveness. Super cool.